According to the American Chiropractic Association, more than 31 million Americans suffer from back pain at any given time. And for many with ongoing pain, the idea of back surgery to fix it is scary because they often hear that recovery is long and painful.
But a Western New York spine surgeon is performing a relatively new procedure that reduces recovery time and could even be a step forward in addressing this opioid epidemic. Channel 2's Stephanie Barnes takes us into the operating room tonight to give us a close-up look at this unique procedure.
It's crazy.
For 74-year-old Robert Russo, back pain was an all too familiar feeling. The retired truck driver says throughout his 45-year career, he traveled millions of bumpy miles. All those miles finally catching up with him when he was diagnosed with spinal stenosis.
My legs would burn so bad, my back ached so much.
Robert says he had heard horror stories about back surgery, so before jumping straight to that, he wanted to try some alternatives. First, physical therapy, then spinal decompression. Robert says it temporarily relieved the pain, but didn't cure it. That led him to Dr. Leone, an orthopedic spine surgeon at Sisters Hospital, St. Joseph campus.
And he says, we have this new procedure. It's a robot. He said, and it's 99.9% accurate.
That's going to move into position.
Minimally invasive spine surgery. The doctor tells me it's been around for a few years, but he is the first to begin regularly performing it in Western New York. One reason this surgery is not widespread is because of the cost of the robot. Just one of these soda can-sized machines runs about $1 million. Plus, the surgery is uniquely different from traditional spine surgery and requires many additional hours of education and practice to perform it. Robert agreed to the procedure, and on January 25th, went under the knife and the robot.
Through this one small 3-centimeter incision and a tube through which we will do the surgery, we're going to be able to decompress the nerves, spread the bones apart the way they're supposed to be, put in bone graft and a cage, put in the screws and rods, and basically do everything through that one incision.
The work is coordinated through a computer mapping program. A CT scan is taken of the person's spine and the computer can take it from there. The hospital reports it takes the same amount of time to perform the minimally invasive surgery as it does traditional spine surgery. Dr. Leone says the pros of this surgery over the traditional are significant. Traditional back surgery includes a 7 to 8 inch incision with significant blood loss, a 2 to 3 day hospital stay, large scars and scar tissue, and the use of narcotics to control pain. Whereas the robotic-assisted minimally invasive surgery includes a much smaller incision, decreased blood loss, faster recovery, and less pain, which means less use of opioids.
Opioids and narcotics being as big of a problem as it's been, you know, having a procedure that tends to steer patients away from longer usage of narcotics is actually a good thing, instead of, you know, the typical type of situation where the patients are on much stronger medications for a much longer period of time.
For Robert, just 1 day post-operation, the nurse had him out of his hospital bed walking around, and by day 5, he says he was completely off pain meds.
Believe it or not, when I stood up, my legs felt like I was back like I was 25 years old. There was no discomfort. It gave me my life back. It really did.
Stephanie Barnes, Channel 2 News.